Good afternoon, everyone. It's been a busy few days. In the governor's office, we're viewing everything through two lenses. First and most important is the public health lens. Our thinking is focused on a handful of urgent health priorities. Keeping Arizonans as safe and insulated as possible from this disease. Expanding testing so more Arizonans can know whether they have the virus or not. Giving our doctors, nurses, and healthcare providers the tools and supplies they need to do their jobs. This is the gloves, the gowns, the masks, and the ventilators. And expanding our hospital capacity to handle a surge of patients as coronavirus inevitably spreads. And to that end, since we last met with you, we've done a number of things. We've secured a significant supply of N95 masks through a partnership with the Be Strong initiative and the Verstandig Foundation. I want to say a special thanks to Grant Verstandig and all the private sector leaders who are reaching out and helping out and providing solutions to us at this time. We're aggressively working all these leads to source material and other purchases and donations of these bulk supplies. This morning, Intel, another great corporate citizen in Arizona, donated 50,000 surgical masks to the state. We need more than that, but every bit makes a difference. And it's a key focus of our team all day, every day, and many of the evenings as well. Arizona has received an 1135 waiver for our Medicaid program. Among other things, this will ensure that no child on kids care will lose their insurance because their parent can't afford their premium. To expand access to care, especially in rural Arizona, we are waiving rules requiring a physician to oversee certified registered nurse anesthetists, freeing them up to provide other needed medical services. We're working with Superintendent of Public Instruction, Kathy Hoffman, to set up enrichment centers where children of first responders, critical healthcare workers, and essential public sector workers can receive child care. I'm grateful to Superintendent Hoffman for her partnership and leadership, and to school leaders across Arizona who are stepping up to make this partnership possible. Today, I issued an executive order to expand coverage of telemedicine services. This action will help people to continue social distancing. That's the physical distance, the 6 feet you need to stay away from other folks, while still having access to critical care and services. This telemedicine is the equivalent of using the camera on your phone to talk to a doctor to get what you need. It's like FaceTiming an MD. Additionally, I sent a letter to HHS Secretary Alex Azar requesting special enrollment period on the federal insurance marketplace so that people that have lost their income can purchase health insurance. We launched ArizonaTogether.org. This is a one-stop source where people can donate to those in need, find ways to volunteer, get access to resources, and learn the latest information. That's ArizonaTogether.org. You can donate there if you're well and you want to do something. You can volunteer. St. Mary's, St. Vincent de Paul, all these places need help. The Arizona Cardinals and Michael Bidwell stepped up with the very first donation of $1 million. So a special thanks to the hometown team, Michael Bidwell and the Bidwell family. We are all very grateful for their generosity. And I want to acknowledge the work and generosity of all our philanthropies and charities in Arizona. This will be a team effort, and everyone is stepping up in a big way. As you'll hear from Dr. Kara Christ in just a moment, we're working night and day to ensure our hospitals are prepared for the influx of cases. Bringing more beds online and working this proactively and in a collaborative way with our hospital community. For more on the health front, I'm going to turn it over to Dr. Kara Christ, and then we're going to hear from General Mick McGuire for an update on what's happening at our State Emergency Operations Center. Dr. Christ?
Thank you, Governor Ducey. As you know, Arizona is still in the opening stages of its COVID-19 outbreak, and the number of cases within the state will increase significantly. Across the country and the world, we've seen the impact this virus has on our communities and the healthcare system. And in Arizona, we're faced with the all too real reminder that COVID-19 is highly contagious, serious, and in some cases fatal. So the latest figures for COVID disease in Arizona: today we reported 401 cases in 11 counties in Arizona. There are 251 in Maricopa County, 49 in Pima County, 37 in Navajo, 23 in Pinal, 23 in Coconino, 4 in Yavapai, 7 in Apache, 2 in Graham, 3 in Yuma, and 1 each in Cochise and Santa Cruz. As of today, we've lost 6 lives to COVID-19, and our hearts are with the families and friends of these Arizonans. Over the last few weeks, we've seen these numbers continue to climb, and we expect greater increases as we move forward. We know we have community spread of COVID-19, and as our testing capacity continues to increase, we will find more cases. As Governor Ducey stated, we continue to take steps designed to protect our healthcare workers and increase capacity in our healthcare system. To date, we've seen over 6,600 Arizonans get tested, with a majority of these tests coming from our commercial partners. These tests are limited to symptomatic people or those in high-risk populations, and currently, roughly 95% of these tests are negative, and 4.6% of these tests are positive. While testing capacity has increased, we continue to face the national shortage of personal protective equipment, testing supplies, and reagents. At this time, there's simply just not enough tests for everyone who wants one, so we will continue to prioritize our high-risk populations along with the supplies needed to perform the testing. Yesterday, I activated the State Disaster Medical Advisory Committee, a group of statewide experts to make recommendations on the use of scarce medical resources, and this includes equipment and testing supplies. The purpose of this committee is to develop guidance and recommendations for our healthcare partners as they address resource shortages and make their job a little bit easier. These recommendations have been posted on our website for our healthcare system partners to utilize at azhealth.gov. In addition to the many steps taken to preserve equipment, ventilators, and other critical medical resources, we're working around the clock to secure critical resources in our hospitals. In the last few days alone, our first portion of the Strategic National Stockpile was delivered to our county health departments for distribution to their communities. We have already started receiving Arizona's second portion of the state's Strategic National Stockpile, including 145,000 surgical face masks, 61,495 masks, 72,100 latex gloves, 27,800 face shields, 22,630 surgical gowns, and other critical resources. And we're already placing the order for the third portion of Arizona's allocation of the Strategic National Stockpile from our federal partners. In terms of hospital resources, we must continue to increase our bed capacity. The estimated need is rapidly evolving as we gather new data. With a potential surge of COVID-19 patients, we expect it to be above and beyond our current capacity of beds. Our hospitals and staff are on the front line of this response, and their continued ability to care for our community in a safe manner is critical in Arizona's success in overcoming COVID-19. Our hospitals have been preparing for this over the last 2 decades. In the last 5 years alone, the state has distributed nearly $15 million for the Healthcare Preparedness Program. For those reasons, I sent a letter this morning to all Arizona hospitals urging them to prepare by activating their facility emergency plans, implementing triage processes to relieve excess burdens on their emergency rooms, identifying additional room in their hospital to take on a significant surge in patients, instituting plans to optimize staffing levels within their facility by cross-training staff and activating medical volunteers, evaluating supplies and equipment and creating facility guidance for optimization of scarce resources, strengthening their communication with their healthcare and public health partners within their region, and reporting key hospital capacity data through EM Resource as required under the Enhanced Surveillance Advisory that was issued by Governor Ducey on Monday. To assist with creating additional bed capacity, we are working with the Army Corps of Engineers. Earlier today, Governor Ducey, General McGuire, and I met with Brigadier General Kim Colleton. The Army Corps of Engineers is currently on site evaluating our alternate care sites, including pre-existing hospital sites to add additional beds, large venues that can provide many beds in a step-down or recovery care environment for those ready to leave the hospital but unable to go home. And we've requested additional federal resources, including 3 field hospitals, 2 for Phoenix and 1 for Tucson. And these are just a fraction of the items of the work that we are doing in partnership with DEMA to build capacity in our healthcare system. And finally, I know some of you have heard these tips from me many times. I'm going to shorten them this time, but there are important messages. So wash your hands, do not touch your face, avoid close contact with people. In fact, stay home whenever possible, but especially when you're sick. Keep 6 feet between you and others when you are in public. Stay home when you are sick, cover your cough, disinfect objects and surfaces, use telemedicine whenever possible, avoid social visits, shopping trips, and discretionary travel, and protect your older loved ones. So don't visit nursing homes or long-term care facilities. And we encourage everyone to practice social distancing everywhere. I want to thank our public health professionals, our healthcare partners, and our communities for their dedication to the people of Arizona and the tireless effort to keep our communities healthy. I'm going to turn it over to General McGuire.
Well, good afternoon, everybody. Governor Ducey, thank you for the opportunity. I wanted to talk to all of you today as the Director of the Department of Emergency and Military Affairs about our activities that have occurred since March 13th when we activated the State Emergency Operations Center. First, I want to remind all of you that, like all emergencies, there are cascading impacts that affect the whole of the community. And as a result of that, we have a national incident management system by which we manage all emergencies in the state. In this case, in support of Dr. Christ as the public health expert for the great state of Arizona. Since the 13th of March, we activated the Emergency Operations Center and have had liaisons from all state agencies in our State Emergency Operations Center fielding requests for resources. That incident management system allows us to execute a system where all emergencies are locally executed, state managed, and federally resourced if we cannot meet that at the state or local level. FEMA Region 9 out of Oakland has been a great supporter, and I want to talk to you about 2 things that have happened since the 13th about resourcing requests. First, to dovetail onto what Dr. Chris said about the Army Corps of Engineers. Last Friday, we made a request through FEMA Region 9 to send a liaison team of military Corps of Engineers construction planners that can quickly activate larger facility in the event that we need more beds. That team was requested on Friday. They arrived in Phoenix at our Emergency Operations Center under Emergency Support Function 3. Our liaison from the Department of Transportation is involved in that, as well as Dr. Christ informing that, and we are looking north and central and south at regional surge capacity that we may need. They have engineering expertise, they have planners, and ultimately they will develop a plan over this week. They arrived on Sunday, have been on scene planning, and we will submit proposals to Governor Ducey for consideration should that become an eventuality. A second example, I know many of you are interested in what's happened with the National Guard, and it is my role as both the FEMA analogous director here in the state, as well as military affairs, As I said, when we can resource things in the state, we do that. And ESF 11 is about food security. Under that, we formed Arizona Task Force Logistics, which is led by Brigadier General John Hofer. After the governor activated the Guard last Thursday, we immediately looked at where the greatest needs were. And as of today, I'm proud to report that we have over 750 of our fellow Arizona citizens that are on duty today. We met our first missions with food banks on Sunday and Monday. Yesterday, we were able to surge capacity to larger food retailers around the state. And tomorrow night, we should have trucks rolling to help fill any gaps and seams in the logistics train in our supply warehouses in all the counties around the state. So I thank the governor for his leadership on this. We look forward to continuing to serve the great citizens of this state. And I know that there's no greater team in the nation we could be a part of, and we're absolutely confident that we will meet the needs of this epidemic that we see growing in our state. Thank you.
Thanks so much, General McGuire, and thank you to the women and men of the National Guard. They're the best in the country, and we're very grateful for their extra effort in this situation. I want to say thank you to Dr. Christ as well. So I said we're going to view this crisis through two lenses. The first was public health. On the second front, we are working to mitigate the economic impact of the coronavirus on individuals who are most vulnerable, on our small and medium-sized businesses, and for people that live paycheck to paycheck. There's a lot of great Arizonans, thousands and thousands of them, that have never asked for anything from the government, and today they are without an income, and many have their businesses at risk as well. So here's what we've done on the economic front. Yesterday, I signed an executive order to delay the enforcement of eviction action orders for renters who are quarantining or facing economic hardship. This will remain in effect for 120 days. This ensures that no one who is suffering the impact of COVID-19 is going to be put out of their house because of an inability to pay their rent. Arizona has also requested a series of waivers for our federal food stamp program. If approved, people will be able to get more benefits faster and for a longer period of time, and they'll be able to get hot food. In addition, Arizona has received several federal waivers for the Women's, Infants, and Children's WIC program, or WIC. These waivers allow families to keep their WIC benefits without needing to come into the office for their normally required checkups. Arizona has also been awarded more than $5 million for our Meals on Wheels program to provide meals for older adults. We also know what else is on the minds of Arizonans who have lost their jobs and lost their incomes. It's those ongoing monthly bills, the big ones, mortgage payments, utility bills. We know that April 1st is going to be hitting soon, and we want to protect people from losing their homes or having services such as internet, cable, or electricity shut off. We know there are real people out there feeling real pain. There are people in the community that are already living paycheck to paycheck, and they can't afford to have their lives upended any more than it already has been by this crisis. Yesterday, I met with the banks, the utilities, and our telecom industry. Today, I'm meeting with our commercial real estate industry. We need solutions for people and small businesses, and there will be more to announce soon on this front, but I've made it clear to the leaders in these industries what my expectation is. And it's that we work together in a public-private collaboration so that no one loses their home, no one is kicked out of their apartment, no one has their services cut off as we navigate through this crisis. These efforts will provide assistance to those who need it most during this difficult time. and it's just the beginning of many steps our office will be taking. There will be more to come on the economic front. We're keenly aware of the impact this crisis is having on everyday Arizonans, and we're going to do all we can to help reduce the impact and prepare us for a recovery when we get through this. And we will get through this. And I'm confident that we'll come out on the other side stronger and better. But we have work in front of us, and that's what we're focused on today. And now we'll take some questions.
Start here with Mark.
Governor, thanks a lot over here. I live in a neighborhood with a lot of retired folk. See them in the morning when I walk my dog at like 6:30 in the morning. They watch you every time you and Dr. Chris are on. They believe in what you say and they're following what you do. But there has been real concern in the last 48 hours or so when they hear the president talk about maybe jump-starting the economy right after Easter. And they're afraid that's too soon. And they are afraid. What do you tell those folks?
Well, first, I don't want anyone to be afraid, but I understand there's a real fear and anxiety out there. And that's why every day I'm focused 100% on the state of Arizona, on this public health crisis. And I'm surrounded by some of the smartest people, not only in the state, but in the country that are helping and assisting here. We are going to navigate through this. I also am looking forward to a day when our entire economy reopens and booms again. But we have many serious issues in front of us. We're seeing what's happening in other parts of the country that were affected earlier than Arizona was. We're learning from what they're going through. It's why we're a step ahead of this. We're able to source masks and gloves and gowns and ventilators and increase hospital capacity before it's urgently needed. So we want to focus on the public health emergency first. That's our first focus. We know people are in need economically. We want to help them mitigate and navigate through this so that they don't lose their home, they're not out of their apartment, they don't have essential services cut off. And then at the appropriate time, we can talk about what's next. But this focus on public health and economic relief is where Arizona is in the equation.
And that future time is not short term, not sooner. It's more later than sooner, would you say?
Well, I've said that you want to think of this as a marathon, not a sprint. But anyone who tells you when they know this will be over, they are guessing. There will be certain parts of the country that are able to overcome it more quickly, but likely because they got hit sooner. So we're in a position right now where we can plan ahead, we can be proactive, but we have to deal with the issues in front of us. And I'm going to make every decision possible, working, like I said, in alignment with public health and the Centers for Disease Control and Prevention, that Arizona's making the right decisions. And we've put out the declarations and the executive orders so that people can access essential businesses. People have access to food. Our restaurants are working overtime to provide takeout service, and we're going to stay on that path.
Howie? I've got two questions. Let me ask maybe the more basic one. I understand the order about the 120 days of no evictions. But if the 120 days goes up, and I realize it can be extended, your order says people are still obligated to obey their lease, are still tied to their lease. So at the end of 120 days, they're going to owe 4 months' rent. What good does it do to put off what seems to be the inevitable if on day 121 they're going to have a 5th month rent of due? So
this is day one, and what we wanted to do was to give some runway to reduce anxiety and to give some confidence in what the potential is for the future. The reason the order's for 120 days, because that is sometime into the future. Now, if you have a job, if you are receiving your pay, we would have every expectation that you would make your rent payment on time. This is for the people in our community that have been displaced by COVID-19 and don't have any income. We're going to work with the associations, the landlords, the banks, like I said, so that we can mitigate this crisis. The idea is that we navigate through this and people come out of this in a position where we restart our economy. We want to keep as much of our economy that's responsible and safe going along the way, but right now there are some people that are being affected by this, and that 120 days can give them some comfort in their position.
The other part of the question, Governor, is I have been through the statutes, the emergency statutes, things that allow you to tell the general there to give me a vaccination, to quarantine people, everything else. You've issued a whole set of orders telling insurance companies what they have to do, telling cities what they may not do. I haven't found any authority. Where in statutes are you finding the authority to do this?
We're advised by good legal counsel, and I want you to know with the banks, the other companies in the private sector, we have not imposed our will on them. We have sat down with them and said, we don't want to see anyone lose their house. Can we work together on this? Can we communicate in concert with a program for the people that will be missing a mortgage payment or missing a rent payment so they can understand what that means today and what it will mean into the future?
We'll go to Bram, and then we're going to take one from the screen.
Thank you very much. Can you talk about unemployment benefits? So I'm talking to Senator Sinema's office this morning. I'm told this rescue package will award up to $600 a week more in unemployment benefits. That's 2 or 3 times what we offer every week. But it's up to you as governor to decide how to use that money. You run the program. So how will you use that extra money?
So very good question, and I'm thankful that the United States Senate finally passed a program. Like I said, we've got an economic relief program from the state level, and I know that the good people of Arizona understand that the state of Arizona doesn't print money. It's not in a position to borrow money. So we have to use the assets that we have, and now that we have a clear sight line to the package that has been passed by Congress, we can complete the program that we're going to put forward, and this will be ongoing. Just like you're hearing today about no evictions, we don't want to see anybody removed from their home, we don't want to see anybody's cable or internet cut off, there will be more to follow. We got to dig into the total package. It changed quite a bit over the last several days.
Given the jobless claims we've seen over the last 8 days, which are historic, do you want to tell folks now? Can you tell them now?
What I'm telling them now is what we have. We are working on this. You can see our program has been expanded broadly since we visited 2 days ago, and I expect now that we know what the federal program is, along with what's possible from the state, we're going to be getting the details out.
A lot of jaws just dropped when you said you're embracing Obamacare. Can you explain your thinking to folks?
That's not what I said. That's not what I said.
The federal marketplace to open up now.
I did not. I said I'm going to stand by the statement that I made. We don't want anyone falling through the social safety net. We don't want anyone falling through the cracks. If you remember, I worked pretty hard in 2015 to balance our budget. And I did it so that we would have some resources if a rainy day ever came. And a rainy day is here.
We're going to go to the screen real quick. Peter Seymour from KTAR, you'll be first.
Good afternoon, Governor Ducey and Dr. Chris. My question is for both of you. Maybe you can each answer one at a time. We learned the other day from Maricopa County's health director, this is Dr. Rebecca Sonnenschein, that she was saying ordering closures of bars and schools and ending dining service at restaurants was a premature response to all of this. And then I also wanted to say that she added that sheltering in place, if it were to work, if it's ever ordered, would only work if it's done for an entire year until the COVID-19 vaccine is released. I'd like to get your reactions to this because it seems like as many cities are on board with what the state is doing, but it looks like Maricopa County's health director has a different
Absolutely. I can take that question. So the state and the governor are actually in agreement with trying to keep schools and restaurants open. We did this so that we could have a statewide consistent policy with the locals being able to go more strict. However, we do believe that there is so much more to this response and this outbreak than just avoiding the virus. There are mental health impacts, there are social connectedness impacts, there are nutritional impacts. So we're trying to look at it holistically from the public health approach. But when we looked at the facts that were going on statewide, it made sense to make sure that we had appropriate resources at our schools when our children are there, and to make sure that we were keeping people safe and not having different directives in different jurisdictions.
We're going to do one more from the screen. Maria Paletta from the Republic.
Hello, Governor, given concerns about community spread, do you have any plans to issue additional guidance for state employees when it comes to which positions are necessary to do in person? I think we can all understand that law enforcement, emergency medical, and so forth can't work from home, but there seem to be a lot of state workers who are still being required to show up who could feasibly complete their tasks or their jobs remotely.
Well, thank you, Maria. And yes, there will be additional guidance for our state employees. I want to say a special heartfelt thanks to our state employees who are working so hard through this crisis. We are in a position at the state level where there is a job to do. And I look at the ship of state, and the folks that work for the state are in the captain's chamber. So the people that are necessary are showing up every day to be helpful, and we're allowing people, of course, that are sick to go home, people that are not essential to be inside a state building, inside their office, or at a desk to work from home. There's been guidance on that. There will be continual guidance, and we'll continue to do that. In terms of the public servants in the governor's office, I expect the public servants to serve the public. And they've been showing up every day, including weekends, and will continue to do so. If they're sick, they're at home.
Back to you, Nicole.
Governor, are we any closer to stay-at-home orders? If not, are we risking lives? If we are we risking the economy? You say health is driving your decisions. We saw your list of essential jobs that you want to keep open. So is that what's driving it?
So we want to do every escalation and elevation of whether it's a declaration or an order or a guidance, given the facts, given the science, the cases. If you look at the graph from the day of the first case to the number of cases that we're managing, factoring in hospital capacity, and of course we want to have more testing. So we believe that there are additional cases in front of us, and as I receive the guidance in alignment with CDC and Dr. Kara Christ, I will be changing those directives.
I have not seen the graphs. I would love the graphs that I have been asking for, so if you could pass those along so we can see
You can
what this is doing.
azhealth.gov, and we'll make sure you have access.
They're not on there.
Dennis, please.
Yeah, I want to go back to the unemployment insurance claims out there. Since the beginning of last week, over 50,000 claims have been made. I talked to somebody today. It's like, look, it's taking forever for him to just get through and get his benefits. The website had crashed. People are calling, getting busy signals. What are you doing to try to streamline this process for this situation where the state doesn't appear equipped to handle it?
So we are equipped to handle this. This is a real challenge, and my heart goes out to everyone who was working 2 weeks ago and now they're applying for unemployment benefits. The answer in terms of now that we have clarity to what's happening at the federal level, we're bringing in additional servers. I mean, I gave out the azhealth.gov website, and I think Kara might have clenched a little bit because it's getting hit millions of times a day when traditionally it gets hit thousands of times a day. And it's the same thing with these unemployment benefits. In the Great Recession, it was a path to bottom. This has been a cliff. So we're going to work overtime to make sure that people are getting their benefits and we're being responsive. But yes, the technology of everything inside state government is being challenged, and it's also being reinforced. We're in a position where we have the resources to do that. And we want to use those resources, not really to buy servers, but to be helping people out there that need the help.
Well, now that the state is getting clarity from Congress, again, follow up on Bram's question here.
The bill,
Why not give clarity to those tens of thousands of workers right now
yes,
that are applying for benefits that they're going to get more than $245?
I'm giving clarity on where we are. The bill passed a couple hours ago, and we're meeting with you nearly every day.
We're going to go to Stephanie, please, and we'll go back to the screen.
This question is for Dr. Christ. How many ventilators and ECMO machines does Arizona have, and how many do you think we should have?
So we are continuing to survey our outpatient surgical centers to identify where those additional anesthesia machines and machines that can be changed over so that they can provide ventilation. We anticipate we are somewhere around 1,000 ventilators statewide. What we are hoping is to get up to about 4,500 or 5,000. We've put in a federal request for an additional 5,000 on top of those that we have in the state. But that's something that we're continuing to assess, and we can continue to make additional resource requests for.
Stephanie, real quick, let's go to the screen. Christopher Conover from AZPM in Tucson. Christopher, do you have a question? Okay, if not Christopher, let's go to Brenna Goff from Bloomberg. Brenna?
Hi, yeah, this question is for Governor Ducey. What would your response be to mayors and other city leaders who are concerned that your executive order on essential businesses limits their ability to address the pandemic locally based on local circumstances?
Well, I want to say to the hardworking mayors out there across our state, I share their concern on what's happening with coronavirus. I want to make certain that our state is speaking with one voice, that there's clarity out there and not confusion. When there's a patchwork of directives, especially when we have such large metropolitan areas with so many mayors interconnected, we want to make certain that the citizens understand what the guidance is, what's safe, what's required of them, and what's most important. So we're going to continue to work in that fashion to make certain that people have the facts and know the information that they need to know to live their daily life.
Coming back to the room here, we're going to JJ with AP. Governor,
April 1st, you mentioned earlier, that's a big day on the calendar. Rent's due, mortgages are due for individual business owners. Is that a date that's looming large in your mind? And, are you working to, is the relief that you're going to be offering going to be there in time for that date?
Well, April 1st was a date that was looming large in my mind until we were able to put out this executive order so that no one knows, so that everyone knows that no one will be evicted on that date. And in terms of the mortgage protection, the essential services, the internet, utility, the heat will be coming soon and people will want to turn on their air conditioners. We wanted there to be clarity there, but there is also, we understand the unemployment benefits, the other things that need to be addressed. We wanted to bring clarity to everything that we could today, but this economic relief package will likely be talked about for some time into the future. We wanted to give visibility for the next 120 days on what we have now, and there's going to be more to follow, JJ.
let's go to Mark, and then Nicole, and then we'll wrap it up with Howie.
This is for the doctor, if I could. Doctor, in your initial comments and as well the generals, you talked about surge.
Yes.
And the general saying he wanted to be prepared for potential surge in the northern part of the state, central and south. What is your modeling showing you? And is there a time frame you could place us in that lets us know when we're in it, when things are going to be as bad as you think they may be?
When we look at the modeling based on the number of cases and the trajectory, we anticipate that we could need an additional 13,000 hospital beds and an additional 1,500 ICU beds. That's on top of the current 16,000 beds and 1,500 ICU beds. So that is what we're working to get to. We believe that the peak of our illnesses will start mid to end of April, with peak hospitalizations in May. That's what we're doing. I don't have this is all based on computers and very smart people, but that's what we are trying to get ahead of.
I just want to follow up on
Yes.
testing. I just got another email just now. They've been waiting 10 days just to get a test. Like, I know you say that you guys are increasing private labs, but the reality is this is what we're getting all day. People not getting tested. What do you need to do to increase testing and to get these people tested?
So what we need is for the supply chain to open up and give us nasal swabs, viral transport media, and the reagents used to run the chemical reactions that the tests do. That's where our shortages are, and it's a national shortage. We continue to ask for additional resources, and they've been coming in slowly. We know Banner has stood up several of the drive-thrus. It does require an appointment. It does require you to have symptoms, but the directions on how to get an appointment with them are on their website.
But you have said not everyone's going to be tested, so who should be tested? Can you tell the people that not maybe everyone needs to be tested?
Exactly. So not everyone needs to be tested. Those that are symptomatic, that have a mild course of illness, a lot of people can just stay at home, treat their symptoms. If they tend to worsen or they get severe shortness of breath, chest pain, or a worsening fever, they should go in to call their healthcare provider. However, those that we would want to get tested would be potentially symptomatic healthcare workers, because they are our front lines. Symptomatic critical infrastructure workers, those people that work in the utilities and keep our essential functions operating, and then those that are severe and hospitalized.
Let's go to Howie, please.
Governor, let me come back to the question that was asked earlier about the cities. I did talk to several mayors yesterday, including Mayor Romero, and she said the problem with your directive of what she cannot do, he says golf courses, playgrounds, like where you got equipment, personal care, like spas and massage parlors. Why shouldn't cities be able to decide, no, we don't want people to go to spas and to hairdressers and things like that on your order if you're so to allow that?
The executive order that I put out on essential businesses so that we could plan ahead, and like I said, that was a proactive administrative step, is something so that private sector folks could understand what the situation was going to be. Our directives have been in guidance with the CDC, the NIH, and the Arizona Department of Health Services, and they're going to continue to be that way. They're not going to be political decisions, and they're not going to be guesses. And that's how we're going to continue to operate, and that's how I've operated to date.
Ms. Chris, if you can come up, because I want to follow up on that. Is it safe to have people going to massage parlors, to hairdressers, to barbers? You're talking about 6 feet. You know, you and the governor, maybe not quite 6 feet. But is that safe for people to be going to those kind of places where you're clearly within a foot? Somebody's leaning over you, cutting your hair?
So our recommendation would be that individual social distance. If they are sick, they should stay home, and if they are high risk, they definitely should stay home. We will continue to evaluate the data and make recommendations that we feel will keep the public safe.
It's about the time that we have. I know you guys have a lot of questions. You can always email me.
You know, I always have one more, but Dr. Chris just laid a very important timeline. I think, folks out there really need to hear again and understand. Talking about the peak hitting in May, a surge of cases continuing until then, and then peaking in May. Do I understand that right?
So we believe that we're going to hit a peak or start to peak in mid-April to the end of April based on our modeling. And it's not perfect, Bram. So, and then hospitalizations peaking in May as people potentially get sick.
So if you're modeling for that, you've been modeling for like how many cases you expect, how many deaths? Have you guys been looking at those numbers?
My team has. I don't know those off the top of my head, but they are looking, and depending on, that's one of the things that we're taking into account is as we look, we don't want to potentially shut down too early because you could then have to do it again and again. So we're watching all of the potential modeling.
And in closing, the idea is to reduce the number of deaths, reduce the number of illnesses. That's what we're focused on every day. That's what the decisions have been to date, and that's what they'll continue to be. Thanks all very much.